Okay, look at us. We're live on Facebook. Good morning, Facebook. It's you are watching Scan FYI. I'm Andrea. I'm the program director.
Good morning. I'm Marybeth Kwapniewski. I'm the program coordinator at SCAN. Thank you all for joining us this morning. We have a special guest, Dr. Fisher from Monmouth Medical. But before we begin, I would just like to give credit to Care One, who is sponsoring our SCAN FYI this morning. Care One is a family-owned and operated healthcare organization with more than 45 years of service. Their programs include post-hospital care, rehabilitation, assisted living, memory care, long-term care, and a variety of clinical specialty programs. They have 4 locations in Monmouth and Ocean County, in Wall, Atlantic Highlands, Holmdel, and Jackson. Care One has been challenged with caring for COVID-19 patients and is proud to say that as an organization, they have over 2,400 patients and residents who have recovered from the virus. Their protocols have been recognized by the state of New Jersey as best in class. Care One has been here all along, caring for those in need, and they look forward to continuing to serve our communities. For additional information on Care One, please visit their website at www.care-one.com. Thank you, Care One, for sponsoring. So good morning, Dr. Fisher.
Wait, Marybeth, I'm just going to interrupt because you know something. Hey, the magic of technology. We want to record today's session. So would you kindly make me a co-host so I can record?
I can do that.
Yeah, sorry, Facebook. You know, we record all of our SCAN FYIs and then we put them on SCAN's YouTube channel so people can just watch them anytime they want. And we forgot to do that, so. And as soon as Marybeth tells me she's ready, I'm going to hit
co-host. You're a co-host, you can record.
Okay, record. Okay, we're recording. So once again, let's just say welcome to SCAN FYI. I'm Andrea, Marybeth, Dr. Fisher. Okay, now we're good to go.
Good morning, Dr. Fisher.
Morning.
Good morning. Thank you so much for being with us today.
My pleasure.
You know what, Dr. Fisher, before we even begin, why don't you just tell everyone a little bit about you, who you are, where you're from?
Sure. I'm a pediatric infectious disease subspecialist. So this outbreak has been right down my alley, unfortunately. And I'm the medical director of the Unterberg Children's Hospital here at Monmouth Medical Center.
Okay.
So today we're going to talk about emerging and back into the community, right? Slowly but safely.
And Marybeth, you ask it. What is our number one question?
So grandparents want to know, how can they interact with their families and in particular their grandchildren?
So that is kind of the number one question for all of us. And whenever I talk about COVID-19, I always start with a disclaimer. And the disclaimer is important because information is literally changing by the hour. So I just want you to remember that what you hear me saying today, June 24th at 9 o'clock in the morning, may be out of date by the time I finish talking, by the end of today, by the end of the week, or possibly the end of the month. So, and the other thing I should say is this is advice from me as a infectious disease doctor. It doesn't carry the weight of our health center or of anyone else. These are my personal opinions. So it's very important to me. You can see I have gray hair. It's important for me to think about when I can get back into the fray of things and interacting with everyone in the same ways that we interacted before. So I think for all of the grandparents out there, the things that, and the parents out there, the things that you have to think about is, what are your particular risks? So are you at higher risk to get sick from this nasty virus or not? What puts you at higher risk can be just your age. And it's age 65, which to me is, not very old. In my opinion, old is 10 years older than I am. So 65 is really young. So just age can put you at risk, but also having any kind of health problem, whether it's diabetes, whether it's obesity, whether it's high blood pressure, heart problems, lung problems, kidney problems, liver problems, any chronic illnesses that require you to get ongoing care are going to increase the risk that you will get very sick when you get this virus. It's possible that we're all going to get this virus eventually, but for those of us at risk, I would like to wait to get the virus until we have treatment and until we have a vaccine. And we're not there right now. As a matter of fact, I'd rather get the vaccine before I get the virus. But we don't have a vaccine and we don't have effective treatment. So that means that each of us has to think about what our individual risk is and what the benefits of what we're going to do are. So if you're at high risk, you're going to be a little bit more careful about how much contact you have with other people. Now remember, the people who are transmitting this infection are adults. It's not the young children that are the transmitters. This is a very unusual virus. So it's the adults who are spreading it from person to person, person to child. So your risk depends on how many different adults you come into contact with. At the beginning of the outbreak, we thought that only people with symptoms were contagious. But we now know that you begin to shed the virus a few days before your symptoms. And some people never get symptoms, yet they are shedding the virus and they can transmit it. So that's why it's very difficult for you to figure out exactly what your risks are. So let's say my grandchild lives next door to me in New Jersey, in an area where we're not seeing very much disease. And the parents of that child have been able to stay at home and not had a lot of contact with other adults. Well, that's going to be a very low risk situation. Let's take it the other way. What if your grandchildren are down in Florida in an area where they're just beginning to see an increase of illness? Well, for you to get to them to hug them, you would have to take a plane or a train or a bus. All of that travel time is going to put you at risk, and you're going to an area where illness is increasing. So if you're at high risk, I would say now is not the time for you to do that. So it's not, there's not a one size fits all at all here. It really depends on where those children live, where you live, what your risks are. And then of course, what are the risks of those children? Although children are not most children are not at high risk, children with diseases can be at much higher risk. So children with cancer, children who have to take medicines that suppress their immune system, they are at higher risk. So in those scenarios, you're going to be worried that you don't want to make them sick. In the other scenarios, you're much worried about people making you sick, and then you might transmit it either to your other loved ones.
So if your kids and your grandkids are very local to you, and you feel comfortable that everyone has been doing a good job of social distancing, it would be reasonable to say that hugging would be okay.
I think we're getting very close to the time when hugging is not only okay, but it is a great thing. But again, you have to individualize that and figure it out. So, it may be your child lives right next to you, but the parents of that child are in a situation where they have to go out into the world and they're being exposed every single day. That might not be the same, kind of risk. The other thing that the American Academy of Pediatrics talks about is, we like to call it physically distancing, not social distancing. We want you to be socially up close and personal all the time. Do it by Zoom, do it by FaceTime, do it by anything that you have that you can see those people and talk to them and be social with them. But hugging, that's a little different matter, because that's up close and personal.
Right. That's right.
So it's not a simple answer, obviously, and it takes a lot of thought.
It was much easier to close things down than it is to open them back up.
Well, all right. So the second burning question has to do with going out and getting our hair done, our nails done. And Dr. Fisher, I mean, because everybody is waiting on that. What's your feeling about that?
So I think you have to know your hairdresser and you have to know what they are doing to make that salon safe for you. So if you know that you're going to be one of 2 or 3 people in the whole area and that you are able to physically distance, and you know that you're going to be wearing a mask, and the person cutting your hair or dyeing your hair or doing whatever they're going to styling your hair, they're also going to be wearing a mask, then you're going to feel a little bit better. But again, if you are a high risk person, you may not want to do this right away. You might want to wait a little while until we see how things are going to go. So it depends. If you were in your 50s, perfectly healthy, doing great, you've been able to isolate, you don't have a lot of comorbidities, that's a whole different scenario than if you're 85 and have diabetes, high blood pressure, a number of other things. And yeah, you really want to get that haircut, but maybe you wait another couple weeks. I mean, we've been waiting a while. My hair's getting really shaggy. And I, in fact, am going to get my hair cut this week, but I know I know the person who's cutting it, and I know that they're taking the appropriate precautions.
Protocols, right? What about personal belongings, Dr. Fisher, when you're going into some of these environments? Leave them in the car. You don't want to have them with you, right?
So I think we have to figure out how we protect ourselves. We have to really think about how this virus gets around. How does it go from one person to another person? So we know that the major way the virus is going from me to you or me to someone else is through what are called respiratory droplets. So as I'm talking to you, if I'm singing, if I'm shouting, if I'm laughing, crying, making noise, I'm making those little spit things that get into the air. Now those little droplets stay into the air for about 3 feet, and then they usually drop down either onto a surface or onto the ground. Some of them can go a little further, which is why we say 6 feet. We'd like to be 6 feet away. So what do the masks do? Well, what the masks do is the masks capture those little droplets so that they don't get out into the air. So my risk is going to be much less if I'm around people who have masks on than if I'm around people who aren't wearing masks. My risks are going to be much more inside versus outside. Outside, the air is blowing,
Right.
The droplets are being dispersed. Inside, I have the possibility, and we think transmission is most often occurring when people are face to face, literally. I'm in your face, I'm talking to you, I'm talking at you for usually about 10 minutes is what you need to get that transmission. So I'm not so worried about the people that you pass, and you're walking by and they're walking by. It's the ones that you stop to chat with. Make sure they have a mask, and you should have a mask so you can protect them. Because remember, not all of us who get infected are going to have symptoms. So we're not going to know if our droplets are safe or not. So better we capture our droplets in a mask. Now, as far as your other stuff, as we're talking or as these droplets are falling down, they're falling onto my computer terminal, they're falling onto my desktop, etc. But we don't think that that's a major way the virus is being transmitted, but it's a possible way. So if somebody spits on my computer keyboard, I touch that area, now I have the virus on my fingertips. If it stays on my fingertips, it's not a problem. But I can hand it to you by a handshake. I can put it on a doorknob. I can put it on my phone, or I can rub my eyes or pick my nose, okay? So when I rub my eyes or pick my nose, I'm now taking that virus and sticking it inside my mucous membranes. And that's when I'm going to get sick. Now people say, oh yeah, but adults, we don't go around rubbing our eyes or picking our nose. Well, in fact, this is not only child behavior, this is normal adult behavior. There's even a study where they look to see how often do people pick their nose and rub their eyes. They looked at 2 different groups.
I'm
In a
going to rub
Sunday
my
school-
eyes right now.
Yep, there you go. In a Sunday
Allergy.
school group, everybody's in a circle looking at each other. Nobody picked their nose, but people were rubbing their eyes 1 to 2 times an hour. Then they looked at a grand rounds, a bunch of doctors and nurses sitting in an auditorium listening to a speaker or not listening to the speaker. What were they doing? They were rubbing their eyes, but they were also picking their nose at the same rate, 1 to 2 times an hour. If you don't believe me, when you're outside today, look in the car next to you. Some of us don't have to look outside our own cars, and you'll see that adults rub their eyes and pick their noses. And this is the way we put those viruses into ourselves, and that's when we get sick. So we want you to wash your hands, just wash the virus off, or the bacteria or the other germs, wash them off. It doesn't matter what you use for soap. It's mainly keeping your hands under the running water for 15 seconds. And then try to keep your hands away from your eyes and away from your nose. Masks help because you can't get to your nose if you're wearing the mask properly. Now that is another point. I see lots and lots of people walking around with the mask around their neck. It doesn't do any good around your
See
neck.
that too.
It doesn't do any good on your arm. It only works if it's on your face, if it's covering both your nose and your mouth. So it's got to be above your nose. This doesn't work.
No, I see.
Gotta
I
be
see
up
that.
Out of that.
I
Yeah.
do see
Okay.
that. Yeah. Or I see it dangling under your neck. So obviously, Dr. Fisher, then really you are a proponent of masks. Everyone should be wearing a mask.
Absolutely. The two things that we think have leveled the curve or slowed down this transmission of the disease are wearing a mask and keeping physically distanced. So until we have something else, that's what we have to rely on.
And keeping the hands clean.
And keeping the hands clean.
Hands clean.
Okay.
So Dr. Fisher, do you feel as things are beginning to reopen and we're getting into that slow reentry phase that it's just going to be a requirement that you're going to have to wear a mask out in public? Or
I think that
you should be wearing a mask maybe?
exactly. So I would put it, you should do it, whether it's required or not required. It's for your safety and for the safety of those around you. I see our time is running down a little bit. I do want to talk about healthcare and getting healthcare.
Yeah.
So because we've all been quarantined and we're trying to socially distance, a lot of people have put off their regular healthcare.
Right.
Now is the time for you to stop putting it off. You need to talk to your doctor. Everyone should have a general doctor. Many of us have subspecialists that we see as well. Talk to those doctors and get your routine screening. Some of us are going to need immunizations, whether it's the zoster vaccine or the pneumococcal vaccine, and certainly in the fall, we're going to need the flu vaccine. So make sure that you're getting all of the preventive care that you need, whether it's cancer screening, mammography, colon screening, whether you get your eye pressure checked, make sure you're not losing vision because of glaucoma or because of cataracts. All of these things, it's time to do those now. We've put them off, but it's time to come back. Your doctors are doing everything possible to make it safe for you. Nurse practitioners, same way.
Right.
So now's the time to get back, get your health care so you can stay healthy, so that you can go hug those grandchildren when it's time to do that.
All
Excellent.
right, well, thank you.
Yes.
Really excellent information. And I'm glad you feel strongly about the mask situation. It's upsetting when you go out somewhere and I see crowds of people together and no one is wearing a mask. But we're only responsible for ourselves, right? So.
Well, yeah, but there is one state, I believe the state of Washington, I think I heard on the news last night, they just are making it illegal to be out without a mask.
Yeah, mandatory in public. Yeah, yeah.
So remember, when you're out of doors, it's a little less risk, but when
Right.
you're close, face to face, that's when you need that mask. There are people who can't wear masks. Remember, children under 2 years of age, they can't tolerate the mask. There's some people who have lung conditions where the masks are difficult for them to wear or impossible for them to wear. And then if you're vigorously exercising, you can't wear a mask. If you're swimming, you can't wear a mask. So, don't forget about common sense. which is very uncommon in my experience. But, you know, wear the mask whenever you can.
Okay, well, thank you very much. A pleasure to have you with us. Dr. Margaret Fisher from Monmouth Medical Center.
Thank you so much.
Okay, so we are good to go for today. I want to thank everyone for tuning in and reminding you that we are recording this and it will be on our YouTube channel. Remember, if it's important to you, it's important to us. I'm Andrea Tarr from SCAN, and we'll see you next time on SCAN FYI. Thank you, everyone.
Everyone. Thank you, Dr. Fisher.
You bet. Take care.